Hi, I'm Gary Bebow, CEO of WRHS Health System, and this is my April CEO Connection. And today, I'm really pleased to have Curtis Minette, my guest. Curtis is our Employee of the Year for 2016, and Curtis has been on our staff for, well, over 15 years, serving as our nuclear medicine technologist. Curtis has been an outstanding employee of ours. He actually was Employee of the Month in January of 16, and so in December we actually selected Curtis for the honor of Employee of the Year. And so he had some really strong competition. But I gotta say that of the 12 Employees of the Month, our group of employees really did a great job of recognizing Curtis as Employee of the Year. So Curtis. You know, when you became Employee of the Month in January, you kind of politicked the whole darn year in hopes to become Employee of the Year, didn't you?
Yeah, I kind of did.
You did?
I thought it would be a good idea to work the crowd.
Yeah.
And I politicked a little.
Now, what did it mean to you? Why was it so important for you to be Employee of the Year?
Well, it was an honor. I mean, out of the 12 people, and then plus all the other employees, just to be nominated was exciting. And then the thought of being the one person out of the whole department or the whole Department of Medical Center to be Employee of the Year, it was made me feel good. It was an honor, and I was very proud that I was even nominated.
Yeah. Well, anything particular that you thought that characteristics that you had that resulted in that honor? I mean, what do you do that you feel that was important for you to get that recognition?
Well, in my work in nuclear medicine, whenever I meet people, I try to follow our ADAC thing, acknowledge them, I always try to think, if this was my parent, my mom or dad, how do I want to treat them? And so, acknowledge them, introduce myself, explain what I'm going to do, tell them how long it's going to take and all that. And, always say, do you have any questions? And may I help you with anything? I'll try to answer them. And then whenever we get done, I always thank them for using WRHS Medical Center.
That doesn't come natural, though, does it? I mean, you really kind of got to think about it and really cover your basis in patient interaction, don't you?
Yeah. Sure. For a lot of people, I get, it does. You have to think about it. It's easier for some people. And, I'm quite the talker anyway, and I enjoy interacting with people. And I think for me, it comes quite natural, easy, or it's easy. I do understand that there are things that I need to do to make the patient feel like they're comfortable, that we treat them with respect, and that that we're glad they're here.
Yeah, well, you've been here 15 years. You've seen a lot of changes in the hospital over 15 years, haven't you?
Yes, I have.
Anything come to mind, particularly in the hospital or even within the department?
Well, the hospital's just grown, so I think they've built on at least, 2, maybe 3 times since I've been here. And what I hear most from the people that come in from out of Batesville, like Cherokee Village and Hardy and even Ball Knob areas, that our hospital has grown and how pretty it is. They comment on after they get in here how much they like it, and I do too. I think we've got a beautiful hospital, and it's something that I think all of Batesville's proud of.
Yeah, well, the hospital's success is a great deal. Credit to people like you being on our staff. Yeah, I'm really proud to have you with us, and I know that you're really loyal to our hospital too. You want it to do well, and
I do,
and that's why you're Employee of the Year.
Yeah, well, that's what when I got it, that's what it made me feel like. Well, people see that I do make a contribution, and it made me feel very proud.
Now, what I really want to know is important here is, now, where did you pick an employee parking place to be for this next
I picked it over there by the walking track, so I can just come in, got a straight shot to the door, so I didn't want to get all cold and rainy this fall, but then it didn't even snow this winter. I was so excited about that.
Well, plus you get your picture in the hallway there, the Hall of Honor. Is that the name of it? The Hall of Honor? Yeah. So you got your picture
and
there.
It looks good.
Well, once again, I really appreciate your efforts here at the hospital, and congratulations. And I know you've set an example for all of us to emulate. So thanks a lot.
Appreciate it. Appreciate it.
This month we have 2 employees of the month that I want to recognize. At Stone County Medical Center, Morgan Anderson, a patient care tech in the nursing department, has been recognized for her excellence in patient care. Morgan has been at Stone County Medical Center close to a year, and based on all the feedback I have, she really does a great job up there. At White River Medical Center, Annette Townsley, a care coordinator RN at the Children's Clinic, has been recognized. It's not real oftentimes that we have employees of the month be recognized at the clinics, and I'm really proud to have Annette be the employee of the month for this month. All reports that I receive about Annette have been really outstanding, and care coordination is such an important part of the institution's initiatives, and so congratulations to Annette for that recognition. So if you see Morgan or Annette in the next month or so, be sure to join me in congratulating them on their recognition. Some White River Health System news that I want to report is that March 30th was Doctor's Day at White River Health System, as it is throughout the country. It's always the last Thursday of the month of March that we recognize that, and you know, all of us are really dependent upon having a great medical community that supports us as hospitals. And so if you see physicians, thank them for the hard work and effort that they provide to our communities and for the support that they provide to us. So Doctor's Day is an important annual event that we should all use it to be sure to express our appreciation to physicians and their contribution to our healthcare system. An important announcement of an addition to the administrative team is Terry Bunch. She's an RN, and she'll be our Chief Nursing Officer at White River Medical Center. We've gone through an extensive search for a Chief Nursing Officer, and I'm really looking forward to having Terry join us on April 3rd. And so as you see Terry in and around the hospital, be sure to welcome her aboard. In April, there will be an employee engagement survey that will be seeking feedback from employees on, well, the things that the health system does well and those things that we can improve. And so when you get the employee survey, engagement survey, that take a few minutes and complete it and give us the benefit of your feedback. We have some 1,700 employees within the system, and we're really hoping for a high participation rate, because by getting that high participation rate, it will better serve us and be able to respond appropriately. So when you get that, make it a priority, complete it, and send it back in. Some important events coming up that I want to report. On April the 11th, Dr. John Allgood, a radiation oncologist on the staff, will be our community health education presenter. He'll be talking about radiation therapy. It'll be at the Josephine Ray Rogers Conference Center, and lunch will be on us on April the 11th at noon. On April 29th, there will be a walk for arthritis that will begin at the White River Medical Center Rheumatology Clinic. Registration that morning will be at 6:30 to 7:30 a.m. and the walk will begin at 8 o'clock. And if interested, contact Amanda Roberts at the foundation to learn more information about that. So Dr. Singh is the physician who is supporting, leading the effort, and so come on out and let's support Dr. Singh in this event. Also on April 29th, the annual White River Health System Employee Fishing Tournament, it will take place at Norfolk Lake. That starts at 6 o'clock in the morning and should last until 2 o'clock in the afternoon on Saturday, April 29th. Contact Brandon Langle if you are interested in participating in the annual fishing tournament. By now you may have received feedback on the status of our internal medicine residency program. I was really pleased on March 17th to find out the results of those medical students that were interested in joining us and how we rated them during the interview process. And we had 10 slots that we needed to have filled starting in July of this year. And frankly, I'm so pleased to say that of our top 13 candidates, 10 of those had chosen us to come, and and have the residency here. So we've got really a great group of medical students that will be joining us in July, and you'll learn more about them and see them in and around the hospital over the next few months, and we're off to a great start, and congratulations to everyone who's been involved in making the internal medicine residency program a reality in Batesville. I've received a lot of questions about what will the effect on the appeal of the Affordable Care Act will be on White River Health System, and particularly will it change the number of people that are insured in our county, and what will it do in terms of reimbursement to our institutions. Frankly, it's very difficult to know because it's sort of a work in process. As there is clarity in the next few weeks and months, once we get a better understanding of just what the repeal and replacement is all about, we'll be certain to report to you all as employees in the community just what kind of effect that will have on us. Obviously, the Medicare and Medicaid programs are critically important to this health system's future viability, and so we're watching it very closely, and I'll let you all know as soon as we have a better understanding about just what we can expect in the future. So let's keep our fingers crossed and hope that what changes do occur, they will not adversely affect us here in Batesville and Mountain View. That concludes my CEO Connection for April. As in the past, if you have suggestions on how we can make this better in the future, be sure to provide us the benefit of your feedback. So have a great month.